James Carafano, Heritage Foundation, is with us. You say that, what do you think about a domestic travel ban? I mean, we know we've got the international travel ban, and you say that that makes sense from Mr. Trump. What about a domestic travel ban, like you can't go to Seattle or you can't get out of Seattle? What do you say?
Well, I think what would be much more effective from a public health policy standpoint is if you had hotspots where there's a significant number of people infected, having those people self-quarantine and remain in their community, it makes sense. Stopping travel, since it's not, it'd be very difficult in the United States in a sense to keep people from going from one place to another. Even if you stopped domestic flights, people can still drive wherever they want. If you wanted to stop people at the state line, that would absorb an enormous amount of resources. So I think the focus ought to be on what's the most efficacious way to prevent this, and it's social distancing. And voluntary social distancing really is the most effective tactic.
Yeah, but does it go far enough, James?
Well, I think in a country of 360 million people, the size of a continent, I think if Americans do this, and I think the early signs we just saw that incident that you talked about in Boston, where everybody went to a concert and a bunch of people got sick. Americans see that, and Americans largely adopt common sense. I saw this in Washington D.C. over the weekend. Last weekend, on Friday when this started, I went to an event. It was packed. I looked outside the Senate building. There was a long line to get in. I went to a restaurant. It was packed. Yesterday, like a ghost town. This morning, came to the office. I literally could have been the zombie apocalypse. I was the only one in town. So I do see people voluntarily doing the kinds of things that will really make a difference.
Give me 20 seconds on whether or not we in America are prepared to hunker down like this for 4, 5, 6 weeks.
Well, the key thing is the supply chains. If food's coming into the grocery stores, if medical services, basic services are still there, we're the best country in the world to handle this.
Got it. James, hold on a second.